I'm Eric Matteson. I'm a rheumatologist in the Division of Rheumatology at Mayo Clinic in Rochester, Minnesota. And I would like to speak a little bit or talk a little bit about rheumatoid arthritis. Rheumatoid arthritis is a pretty common form of arthritis that affects about 1.3 million people in the United States. It's an autoimmune disease, which means it's a disease whereby the body's immune system attacks joints, causing joint damage to occur over time. We don't know what causes rheumatoid arthritis, although we know that there is some family predisposition to it. People who have family members who have rheumatoid arthritis have about a twofold increased risk of developing rheumatoid arthritis. About 3/4 of people with rheumatoid arthritis are women. We're not sure why that is. Rheumatoid arthritis affects people who are in the prime of life. It can affect, though, people of any age, from little children all the way up to people who are in their 80s and 90s. The average age of onset, though, is right around 55 years of age. The principal symptoms and signs that people who have rheumatoid arthritis suffer from are joint swelling, and often this is many joints. It may be 3, 4, 5, 6 or more joints in the hands, the feet, but also in the knees, the elbows, the shoulders. It can affect the neck. It can also affect the hips. People who develop rheumatoid arthritis have very profound stiffness, so they might be stiff for an hour or 2 or 3 when they first get up in the morning, which is far more than the usual stiffness that most of us get as we become older. Rheumatoid arthritis also can cause fevers. It may cause people to lose weight when the arthritis is very active, and it very much impairs a person's ability to take care of themselves, to perform their daily activities, including cooking, cleaning, even washing themselves, changing clothes, and going to work. The way that we diagnose rheumatoid arthritis is on the basis of symptoms that people develop. These can be the joint swelling, but also some blood tests, including what is called the sedimentation rate and the C-reactive protein. These are tests of inflammation. They're not specific, but they can be helpful when they're abnormal in a person who has joint swelling in aiding the diagnosis of rheumatoid arthritis. There are other blood tests that are more specific for rheumatoid arthritis, including the rheumatoid factor and the CCP, or cyclic citrinylated peptide, which are present in about 60% of people, or 6 out of 10 persons with rheumatoid arthritis at the beginning of their disease. And in people who have more established disease after several years, we might find these blood tests occurring in as many as 80 or 90% of patients. Some people with rheumatoid arthritis actually get involvement of organs outside of the joints. So rheumatoid arthritis can affect your eyes, can affect your lungs, it can affect your blood vessels, it can affect the skin. As an autoimmune disease, the treatment of rheumatoid arthritis is with medications that modify our immune response. Our immune system in rheumatoid arthritis is overactive, and so the immune system attacks the joints and other organs, and consequently, as we think about how rheumatoid arthritis comes about, we also know that drugs that affect the immune system are effective for treating the symptoms and signs of rheumatoid arthritis and limiting the joint damage that can occur with rheumatoid arthritis and limiting the effects of rheumatoid arthritis on organs such as the heart and lungs. The treatments of rheumatoid arthritis include what are called nonsteroidal anti-inflammatory drugs, which are drugs like aspirin, ibuprofen, and naproxen, which are useful for alleviating the symptoms of joint swelling. However, those drugs do not change the course of the disease. In order to limit the damage to joints and limit the damage that the disease causes to other organs, we use what are called disease-modifying anti-rheumatic drugs, which are also commonly referred to as DMARDs. These include drugs such as hydroxychloroquine, methotrexate, sulfasalazine, and a host of what are called biologics. These include drugs like anti-TNF agents, anti-B cell agents, and others. Some of the names of these drugs include etanercept and abatacept and rituximab. In some patients, we also use glucocorticosteroids, the most common form of which is prednisone. We typically use glucocorticosteroids or prednisone for treating very active disease because the onset of action of these drugs is really very quick. Sometimes we use these drugs also for injecting joints that are particularly involved, such as a bad knee or a bad wrist. Patients today diagnosed with rheumatoid arthritis have a far better outcome than patients diagnosed in the past. Patients today with proper and early treatment have a life expectancy that is basically the same as anyone else. They also are much more likely to be able to remain at work, to participate in family activities, and in their hobbies. Patients properly treated today have a lot less likelihood of needing joint replacement surgeries because of the success of modern treatments of rheumatoid arthritis. So overall, while this is a very serious disease, the outlook for patients with rheumatoid arthritis is very good.